Starting from the lateral third of clavicle, we see a trapezoid line, which is a longitudinal ridge running forward towards the lateral end of the clavicle, giving attachment to the trapezoid part of coracoclavicular ligament. Then there is a conoid tubercle placed near to the posterior border of the lateral third of clavicle, which would give attachment to the conoid part of the coracoclavicular ligament. Now, entering the medial two-thirds, there comes the subclavian groove. Its margins give attachment to the clavicopectoral fascia. Then there is a nutrient foramen directed laterally from which blood vessels pass that provides nutrition. Then there is a costal tuberosity giving attachment to the costoclavicular ligament, attaches the clavicle with the first rib.